What is intellectual disability? It is a cognitive impairment that interferes with adaptive skills. It is a neurodevelopmental disorder that occurs before the age of 18. It causes two or more deficits such as ADLs, communication, social participation, education, play, leisure, homemaking skills, and skills to be independent. It affects learning in all occupations. Etiology. There are three types of causes of intellectual disability. There's prenatal, perinatal, and postnatal. Prenatal occurs before birth. It causes genetics, disturbance in embryonic development, and acquired causes such as maternal toxins. There are genetic conditions such as chromosomal abnormalities like Down syndrome, Fragile X syndrome, Prader-Willi syndrome, and Klinefelter syndrome. There's metabolic conditions such as hypothyroidism. There's prenatal infections such as rubella, toxoplasmosis, and AIDS. And there's also maternal substance abuse. Perinatal causes during birth. It causes lack of oxygen to neonate or due to brain trauma that is caused by undue stress during the process of birth. There may be other complications that result in intellectual disability, such as infants born prematurely or low birth weight. Postnatal causes occurs after birth. It causes infection, trauma, teratogen, and neglect. There are different viruses such as meningitis. It may cause permanent damage in the brain. Encephalitis, which is inflammation in the brain, is caused by the mother getting chickenpox, rabies, measles, influenza, and other diseases. Examples of trauma are automobile accidents or falls. For tetragen, infant or small children who are surrounded in household substances can occur life-threatening problems. Examples of neglect, such as poor nutrition and environmental deprivation, such as lack of physical, emotional, and cognitive support. Characteristics and common symptoms of intellectual disability. There's psychological, hearing, and speech evaluations and interventions. There's sit up, crawl, or walk later than other children, learn to talk later or have trouble in speaking, trouble in understanding social rules, trouble in seeing consequences of their actions, trouble solving problems, and trouble in thinking logically. There are four types of functional implication in intellectual disability. There's mild, moderate, severe, and profound. The IQ range of 55 to 69 is mild intellectual disability. It focuses on social and vocational skills to function independently in desired areas of occupation. Minimal support is required. Additional intermittent support is also required. And then there's moderate, which is IQ range of 40 to 54. It focuses on independence and daily skills routine and skills to perform in desired areas of occupation with support and structure. And then there's an IQ range of 25 to 39, which is severe intellectual disability, which focuses on performance of most tasks in all areas of occupation, supervised living, significant amount of impairments in motor functioning and physical development, and lastly is the IQ range of 25 or below, which is the profound intellectual disability, which is assistance and ongoing supervision of basic survival skills, and significant amount of impairments in motor functioning and physical development. Disabilities and intellectual disability include sensory impairments, seizures, and other neurological abnormalities such as fetal alcohol syndrome. There are five types of impacts on development. There's cognitive, motor, sensory, language, and psychosocial development. Cognitive development is slower learning ability, difficulty in problem solving and critical thinking, difficulty in abstract thinking and understanding information, and can get distracted easily. Motor development is slower development and physical milestones occur at a later age, uncoordinated appearance and movement, and low muscle tone. Sensory development, it diminishes sensory modulation abilities, hypersensitivity or hyposensitivity to all sensory stimuli. Language development, decreased ability in recalling and retrieving words secondary to cognitive deficits, such as inattention and impaired memory, difficulty in grasping and have impaired abstract thinking, difficulty in motor aspects of creating language, such as low tone. Psychosocial development is impaired to respond in social cues, can cause shyness and aggressiveness, hyperactive, and distractibility. Considerations for occupational therapy and intellectual disability. There's self determination and person centered planning. There's support and assistance to perform the skills and patterns in all areas of occupation. Development of community and social participation. Interdisciplinary team and family collaboration to support the child's functional social skills and to participate in all areas of occupation, collaboration with the educational team such as teachers and counselors to develop a comprehension program.